Greetings, everyone. My name is Nate Prentice, and I am the therapist at Springfield Psychological who will be presenting the dialectical behavioral therapy group, which will be run on Fridays from 11 a.m. until 12 p.m. The dialectical behavioral group will be comprised of 6 to 10 people who are interested in working on improving their ability to moderate emotions and to relate to other people. So, another component of the DBT group is going to be working with trauma. So, what we're going to be doing is working on managing emotions that are impacted by trauma, as well as dealing with the after effects of trauma, such as flashbacks, intrusive memories, hypervigilance, which is being on guard a lot around other people, that kind of thing. So, the groups, we're hoping to run them for about maybe at least a number of months, maybe about 9 months, possibly more. But we would just ask that participants try out about 6 months or so to see if it's a good fit for them. And I'm sorry, 6 sessions or so, just to make sure that it's a good fit for them. Um, so, what is DBT? Well, DBT is dialectical behavioral therapy. And a big component of it is the idea of acceptance of change. And so, what there are going to be four aspects of DBT that are going to be covered in our group over time, beginning with simple skills and building up into much larger skills and more complex skills. So, the skills are going to cover basically four major areas. The first one will be mindfulness, in terms of first we need to kind of work on ourselves and be able to develop the capacity to understand what's going on with our emotions and to be able to witness our emotions as compared to being caught up in them. Then the other piece is, once that's done, is to work on either emotion regulation, which is basically about changing those, as well as to work on distress tolerance, which is the ability when we're encountering things outside of ourselves to be able to tolerate the distress that's brought up as a reaction to them, but not be overwhelmed. And then, as a result of being able to step back, be aware of emotions, but at the same time not overwhelmed by them and being able to think through them, then what happens is we're able to work on interpersonal effectiveness so that we can relate to people, and in the relating to people, we don't get us overwhelmed. So the goal of DBT is to develop wise mind. What is wise mind? Well, we have a part of our brain that's about thinking. We have a part of our brain that's about experiencing emotion. And when I get into talking about PTSD, we'll talk more about the biology of it. Okay, trauma, that is. We'll talk more about the biology of it. But the goal is to be able to enter into a state where you're able to be aware of the more reasonable mind, meaning like rational mind, uh, being able to think through situations, but also respect, honor, and listen to as data your emotions and your emotional response to things, so that I like to say, there are no invalid emotions. There are facts that are up for question. So your emotions are fine. Your facts may be up to question. And then in that wise mind is a way where you're able to kind of look at both and then decide, what am I doing with this? And what is this? And what am I doing with this? And so I'm hopeful that that will be helpful to you as you grow in this skill. The other thing that we're going to be doing is we're going to be talking about trauma, and we're For most people in the session, most of the sessions, we're going to be basically doing education and management of symptoms. Memory work is optional. Memory work is optional. Okay. And in terms of that, what we'll do is we'll talk about why people experience the traumatic intrusive memories, flashbacks, things like that. We'll also be talking about how to manage flashbacks and hypervigilance in particular. Now, for those who would like to do some memory work, which is going into the memories and getting to a place where it doesn't bother you, the method I would use for that in a group setting it would be different forms of eye movement desensitization and reprocessing. So EMDR is a technique that's been around since the late 80s. I've been using it since 1993. And it is a technique as you can see here, it is a technique that helps with being able to process memories through the use of bilateral stimulation. And it has a ton of research behind it, from the VA to a whole bunch of other resources. It has been tested and it's been shown to be an evidence-based practice, and it's pretty good. The Veterans Administration considers it one of the top 3 techniques for veterans for the treatment of post-traumatic stress disorder. What I love about it compared to the other 2 is that it's minimal impact as compared to the other ones in terms of it's easier to tolerate. So the types of EMDR I'll be using with group members in group settings will be very, very low impact compared to even regular EMDR. In particular, if you want to look it up online, I'll be using the flash technique. And I'll also be using a variation of something called somatic pendulation, both of which are very good at not triggering as much and also be getting good, solid results. So I'm hopeful that those things will help. So essentially, that's what we're going to be covering in our group as we move forward. So here's my call to action for you. If you've not already signed up for the group, which will start on the first Friday after Thanksgiving, and for now is slated to be 1 hour from 11 o'clock until 12 o'clock. Feel free to bring lunch if you'd like. Okay. It's slated to go once a week. That's a matter of discussion for the first group to see if the group would like to do it once a week or once every other week, whatever is manageable. There's also in the call to action, I would ask that if you have not already signed up for it, please reach out to me at N as in November, Prentice at springpsych.com. And I'll be happy to try to meet with you and get you in as soon as possible so that you get in on the ground floor. The other thing is make sure that your therapist is on board with this. If your therapist has any questions or concerns, please have them reach out to me. The only other thing is that I'm going to be using some measurements to follow up on how you're doing with this. The first measurement is one that if you are a Springfield psychological client, you're already doing it, which is the wellness check, also known as the TOPS. I would ask that you continue to use that. If you aren't already using it, please do start using it. In addition, in the email that comes with this, I'm going to be adding 2 other scales to use. One is the dissociative experiences scale, and the other one is the mid-60, which both of which are used to measure dissociation, which is one of the ways that people respond to traumatic events by kind of clocking out and losing track of time and things like that. So I want to see what people's risk factor is for that, so I'm aware. The other one is one that I'd like you to have you and your therapist work on, which is the difficulties in emotional regulation scale, which is the acronym is DERS, DERS, and it's available. Your therapist can set you up to take that in between sessions. And I would just ask that I get a copy of the results of that. That'll give me an idea about how you do with emotion regulation as well. And I'm hoping to do a pre-test and then maybe in 6 months or something like that, a post-test of these scales just to see how you're doing. So if you have any questions or concerns, please do not hesitate to reach out to me. And if you're hearing about this and you're interested, please reach out to your therapist, and your therapist can make a referral. And I look forward to hearing from you and hopefully seeing you in group and working hard with you to feel better. Peace.